to the Busy Mum Show, the show to help mums and their families thrive. I'm your host, Dr. Leonaura Rhodes, and today on the show I'm going to be talking to Dr. Anna Simonis, who is a pediatric dentist, and we're going to be talking about how to help your children keep their teeth and their whole body healthy. Before I introduce you to Dr. Anna, I'd like to tell you a little bit about the concept for the show. I've been helping women and their families for over 20 years as a physician, coach, neurotherapist, and with my book, Beyond Soccer Mum, Strategies for a Fabulous Balanced Life. The next natural step for me was to bring you the Busy Mum Show, where I bring you interviews from experts on all sorts of interesting topics relating to motherhood and family life. So without further ado, I'd like to introduce you to Dr. Anna Simonis. So today I'm delighted to welcome Dr. Anna Simonis. Anna received her doctorate in dental surgery from Columbia University in 2002. She then specialised in pediatric dentistry and has been working with children, including those with dental phobias like my own son, and children with special needs ever since. She opened her own practice, was it 2 years ago?
No, actually it was 2011,
4
years ago.
Congratulations.
Thank you.
And she's married with one son who's in elementary school?
Yes, he's in first grade.
Excellent. So thank you so much for being on the show
thank you
today
for
in your
having
lovely
me.
practice.
Thank you.
I wish you could all see the practice. It's beautiful and there's bubbles everywhere and lovely bright colours, so it's a lovely place to be. So Dr. Anna, I'm always fascinated why people choose their careers. What made you go into dentistry?
Well, it's not one of those things where I knew when I was little I wanted to be a dentist when I grew up. I always wanted to work with children. When I was younger, I always played teacher at school, at home, and I knew I wanted to work with children. And I went to college going into psychology. So I graduated with psychology, and at the time I worked with an oral surgeon.
Yes. And
I got very close with him in his practice and how he worked with his patients, and I coupled it sort of with the fact that I wanted to work with children, and I decided to apply to dental schools. And also, I think one of the major things with me is dental phobia. I did not like going to the dentist when I was little at all. It was not a good experience for me, and so I'm hoping to implement in children a little bit of less of that fear factor.
Yes.
And so that's, basically why I'm here.
Yes, and you do a great job with that.
Thank you.
My son's 14 now and he still has a dental phobia. So.
That's okay. My sister's 39 and she does too.
Oh my goodness. So, Dr. Anna, we've been talking, you and I, about how important the food and drink our children ingest is, not only for their dental health, but also for their general health. So could you tell us a little bit about that? Because I know you're pretty knowledgeable about that.
Well, my major focus in my practice is prevention. And prevention is not simply brushing your teeth and flossing and rinsing and really taking care of that aspect, but it's also nutrition. I think a lot of us as a population in general disregard how important nutrition is to our teeth, and it starts at a very young age. Children, we're a very portable society now. We're always doing things. We're always out. We're always on soccer fields and birthday parties and shopping and holidays. So we always tend to just give what's available to our children when they're hungry. Snacks. Everything is snack, snack, snack. And the bottom line is everything that we eat ultimately becomes a simple sugar in our mouth.
Yes.
And the more of that sugar that's in our mouth, the more the acidity level in our mouth rises. And the bacteria that cause cavities, which is ever present, rely on that acid in order to release what they need to form a cavity.
Yes.
And all of that acidity, a high acidity level in the mouth, leads to more decay. And the more frequently we snack, the more it leads to decay. Even if you have a healthy snack and you eat healthy snacks all day long and you graze all day long, it still is unhealthy because you're leaving that unbalanced level in your mouth.
Yes.
So my main focus is teaching parents how to, as much as you can. I mean, there's got to be some kind of balance. You can't be on 100% of the time with nutrition. Just like everything else in life, you have to find that healthy balance.
Of course.
The same thing as the pediatricians recommend. 3 balanced meals a day, and 1 to 2 as healthy as you possibly can be snacks, and always drink water following all your snacks, and that will bring that level down in your mouth, the acidity level. that also helps your body because your body can't handle grazing either.
Yes.
Because your constant sugar level is high.
Yeah.
And that's not good for your body. It leads to inflammation in your body. It also leads to diabetes, high blood pressure, obesity. So if you keep your mouth level, if you think about it, everything you put in your mouth, if you keep your mouth level, your body can stay level as well.
Yes.
So I try to emphasize that as much as I can. And honestly, a lot of people that come and see me for the first time really don't realize that it's not just about, not eating candy and not eating gummy snacks and not drinking juice. It's about how to balance everything throughout the day.
Yes,
with everything you put in your mouth.
Yeah. So are you saying that so for example, if you were to send your child in with, carrots or an apple as snacks, that's maybe in some ways just as bad, or, if it's still important that they drink water afterwards no matter what they're eating?
Yeah, no, I would much rather. I call an apple nature's toothbrush.
Yes.
An apple is an incredibly healthy snack. It's crunchy. It can help wipe away some stuff off of the teeth.
Yes.
But I always like to say to follow it up with water.
Yes.
No matter what, because it still is a sugar.
Yeah.
I'd rather see them eat apples and carrots than fruit snacks and crackers.
Yeah.
Another thing I like to emphasize is adding a little bit of cheese into their snack packs or something.
Okay.
Not all day long, again, because too much cheese is not good either, but a little bit of cheese, it helps. It has a protein that helps prevent decay. It stimulates salivary flow, which brings down that acidity level in your mouth.
Yes.
And it also helps remove all the stuff that's stuck in your teeth, which is why a lot of people like to pair cheese with crackers, because cheese can actually pull crackers out of your teeth. And baby teeth have lots of grooves on them.
Yes.
So, and then again, follow everything up with water.
Yeah, no, that's a good
water.
Water. Yes. And there's a lot of people, my family, at least my husband and I, are into kind of fruit smoothies and things like that. But I have a concern about those because they often have a lot of sugar in them, and you're drinking them, so you're not actually chewing. And we kind of need to chew our food to a certain extent so that we begin digestion in the mouth.
Exactly.
And so it's kind of occurred to me that, if a lot of parents are encouraging their kids to have fruit smoothies instead, that it's important that they also, chew some food as well.
Absolutely. Chew, because it stimulates the salivary flow.
That's right, yes.
So again, it brings back to the whole acidity level. What I usually like to tell parents is, because a lot of children like to eat yogurts and drink those little yogurt smoothies, which is great. My son has them too. But what I also encourage as much as possible is, you can't always do this in schools, but to try and encourage them to maybe rinse with a little water or follow it up with a little water afterwards.
Okay.
What my son does now is when he has a fruit smoothie, most of the time, not all the time, is he'll get a glass of water afterwards and just rinse his mouth and spit that out. Just with water. Because that'll rid most of the yogurt. And same thing with a smoothie, because a smoothie is most of the times made with water, with yogurt or milk. It'll clear away all of that coating on the tongue, the cheeks, and the teeth, because all of that sits.
Yeah, absolutely.
And it sits and sits and sits, and that's what brings that level down in your mouth of acidity, which is what bacteria love. Yes. That's how they thrive in the mouth. Absolutely.
You're making me lick my teeth.
Sorry, I know. Everybody does that too when they talk to me. It's true.
So what about dental routine for children? I mean, you see children, I guess, from their very first dental checkup.
The American Academy of Pediatric Dentistry recommends, and the American Academy of Pediatrics now, recommends their first dental visit 6 months after their first tooth. Now, a 1-year-old is not going to sit in the chair, and we're not going to sit there and scale and do everything that we do. Sure. Basically, that first session is to counsel parents on hygiene, upcoming hygiene, on nutrition, on dental trauma, on future visits coming here. And a quick look, we do a lap exam where mom or dad hold the child, and then I kind of, have the head on my lap and look in their mouth just to make sure everything looks good. Yes. We use a little infant toothbrush just to brush away. I counsel parents on how it's important to actually wipe off their gums even though there are no teeth as well, because plaque can still sit on gums. Yes. And then every 6 months after that, they don't really fully sit in the chair until they're about 2.5 to 3. I have some 2-year-olds that sit in the chair and I do a complete cleaning and they're totally fine. Wow. I have TVs in here. They watch Frozen, Lego movie, TV, and we try and make it as fun as possible to sit. And if they don't, we do what we can to get it done. Yes. Absolutely. Because it's important. I tell parents, just like you tell your children, you have to go to the doctor to see them for their physical checkup. You have to take a shower to, wash your body. You have to see the dentist to make sure everything looks good in here.
Absolutely. Yeah.
So, and then I recommend brushing twice a day.
Yeah.
And flossing nightly, even if there are spaces between their teeth as young as 3.
Okay.
Take that floss in there and floss the back. Chances are there isn't as much space in the back.
Yes.
Those teeth are there until they're about 10 or 11.
Yeah.
But even if there are spaces, if you show them, it's a routine. It's all building a hygiene routine.
Yeah.
Show them this is what it feels like. This is what it looks like. This is what you're going to feel. As much as you can, it becomes part of their daily routine.
Yes. What's your take on chewing gum as something to...
Chewing gum is, I don't mind it. I don't recommend it daily. I think it's great for children that are a little bit older, maybe in middle school or even high school, and they snack. Maybe sometimes after lunch, grabbing a piece of Trident, which has xylitol in it, which is what I like.
Yeah.
You know, I'm one of the 4 to 5 dentists that recommend.
Yeah.
Because the xylitol does help. It's an almost like acts as an antibacterial, and it removes that chewing gum stimulates saliva and it removes food stuff from their teeth.
Yeah.
I think it's better to have a piece of gum than it is to have fruit snacks.
Sure. Yes.
You know, I'm not a proponent of doing it every single day for small children because I think it encourages the sweetness, which kids love sweets, and then they'll gravitate towards those sweets later on.
Yes.
So that's basically, you know, I don't think it's a bad thing. I don't think it's a great thing to have every day.
Sure. Yes, that's sound advice. So tell me, how do you balance running a busy practice and being a wife and mum?
Well, luckily, I have to say, I have a good foundation at home with my husband does help a lot at home. He does a lot of home stuff for me.
Great.
I'm basically responsible for taking Nico to and from school.
Yeah.
I'm lucky enough that he goes to school here in New Canaan, even though I don't live here, he goes to St. Aloysius.
Yes.
And they have early drop-off. I help him. The perks of owning my own practice is that if something is ever needed, I can go help my son or do something or... I'm a big fan of my lunchtime. I don't sit at my desk and do work. I don't make business phone calls at lunch.
Yes.
I'm reading my book. I'm out running around just doing things for myself. Because that's
you.
that 1 hour where I have no husband, no son, no patients, nobody bothering me.
Yeah, good for you. And you and I have talked about looking after ourselves.
Yes, and that to me is important. My mother always taught me that growing up, how important it is. And she was a great role model. She worked and raised 2 children. There were no babysitters. There were no nannies.
Okay.
You know, my father worked 3 jobs to keep everything afloat. So I kind of took from her and put it to what I do now. And
You had a good role model.
I get flustered.
Yes, I'm sure.
I get flustered. I'm not going to lie. You know, and sometimes it gets to me. I'm normal.
Yeah.
But I try to count to 10 and hope for the best.
Yes. Sounds great. So thank you for all that wonderful advice. So tell us how our watchers can get in touch with you and find out more about your practice.
Well, I have a website, www.newcanaanpediatricdentistry.com.
Yeah.
I always welcome people to even just stop by and look at the office without an appointment if they want to just say hello and see how everything works. Oftentimes parents will call and ask questions. My staff is very well informed. They know how to talk to parents if there are emergencies to kind of help settle them down.
Yes.
But that you can go on, and I have pictures of my office and...
That's great.
Yeah.
Well, thank you so much for
You're
being on the
welcome.
show. That's
Thank
really
you for having me. I really
advice.
appreciate it. Hope I helped.
Yes, absolutely. So thank you for watching. I hope you enjoyed the show. If you did, please like, share and subscribe and head on over to thebusymumshow.com to watch other shows in the series. Bye for now.